When life sciences teams rely on incomplete data, I think the biggest problem is that you don't know what you don't know, right? If you take a look at a data set and you say there's 1 million people in this data set and there's one person in the data set who has my target condition, and therefore I'm going to conclude that the rate of occurrence of my condition is 1 in 1 million, right? That's a really bad conclusion to draw if that data set is incomplete, right? If there's 10 undiagnosed patients hiding in that data set who have the condition, but because of whatever reasons have not yet been diagnosed with it, you just underestimated the prevalence of your disease by an order of magnitude, which is a huge deal. And so relying on data sets that we have a reason to believe are incomplete for whatever reason that may be, at a minimum, I think the conclusions you can draw have to be taken with a grain of salt. And a lot of times the way I think folks try to deal with this issue is first go into limitations with their eyes open. It doesn't mean you can only use perfect data sets. You just have to put asterisks where appropriate on conclusions you draw from incomplete data sets. The second thing you can do is try to get more data, because sometimes, not always, but sometimes multiple data sources can help cancel out the deficiencies of each one. But finally, if we can change the incompleteness or the lack of some quality in these data sets to begin with, that can really help, because then we know we're at least kind of drawing conclusions based on the best available information. That's again where I think IMO Health can help a lot, because we specialize in saying whatever's known at that point of care, at that moment between the physician and their patient, whether that's their symptomology, their history, their diagnoses, let's try to hold on to that as much as we can as those data move downstream. When you do that, you at least have a better confidence that what conclusions you're drawing are the ones most reflected by what was created from that clinical knowledge to begin with. It's not perfect, but it can go a long way to help guard against drawing some of these spurious conclusions.